Hello everyone and welcome back to another anatomy tutorial. This is Dr. Aiyan from the Veterinary Anatomy channel. Today we will talk about the extrinsic muscles of the thoracic limb in the goat, or what's called the shoulder girdle muscles. So let's get started.
So in this view, after we removed completely the skin and the superficial fascia and the cutaneous muscle in this area, the cutaneous muscle of the trunk, for example, and dissected the superficial muscles here. Now we can describe some of them. So the shoulder girdle muscles are some of the muscles which connect the forelimb to the trunk and to the neck, and sometimes to the head. As you know, there's no real joint between the scapula or the forelimb and the trunk, as the hind limb, for example, is connected via the hip joint to the pelvis and to the trunk. So here there is no joint. That's why we need all of these muscles to keep the forelimb fixed to the trunk. So the first muscle we would like to talk about here is this muscle here called the trapezius muscle. So this is the trapezius muscle. And if you look exactly, you will find that the trapezius muscle has two parts: the cervical part and the thoracic part of the trapezius muscle. The cervical part of the trapezius muscle originates from the funicular part of the knuckle ligament there and from the midline ruff there, and inserts all the way to the spine of the scapula. Let me show you here, as we said before. This is the right scapula. So the cervical part of the trapezius muscle inserts to this region of the spine of the scapula. This is the spine of the scapula and the small ruminant. If we move and talk about the thoracic part of the trapezius muscle, the thoracic part of the trapezius muscle originates from the spinous processes of the thoracic vertebrae there, and inserts also to the spine of the scapula, but the dorsal third of it. So that means here the thoracic and the cervical both inserts to the spine of the scapula. This is the spine of the scapula here. The trapezius muscle is innervated by the accessory nerve, and the function of the trapezius muscle, if you consider the origin and insertion, is elevation of the scapula or of the forelimb, elevation of the scapula. The next muscle I would like to talk about is the brachiocephalic muscle. Brachiocephalic muscle, if you think about this muscle, the name of the muscle, you will find that brachiocephalic, that means this muscle starts from the brachium, and exactly from the humerus, and inserts all the way to the head, cephalic. So brachiocephalic. This muscle has three portions in small ruminants. The first one in this area here called the cleidobrachial muscle. The cleidobrachial muscle, which originates from the clavicular insertion, which is this connective tissue found in this area here, and inserts to the humerus exactly if we put it this way here, to the humeral crest. This is the humeral crest. This is the insertion of the cleidobrachialis muscle. The other part of the brachiocephalic muscle, from here toward the head, we can name it as cleidocephalic muscle, which has two parts, this one and that one. So this one here and that one here. So from here, if you want to give them both one name from the clavicular tendon toward the head, in this case we will name them as cleidocephalic muscle. But if you want to talk about them separately, the first one, which starts from the clavicular tendon here and inserts firstly to the knuckle crest of the occipital bone there, and partially also to the funicular part of the knuckle ligament. So this one called the cleido-occipital muscle. While the other one, if you follow it, you will see that it originates also from the clavicular tendon here, but moves all the way up and inserts to the mastoid process of the skull. And that's why we will name this one as cleidomastoid muscle. Again, quickly, the brachiocephalic muscle has three portions. This one here is the cleidobrachial muscle, the cleido-occipital muscle, and the cleidomastoid muscle. The function of this muscle, in this case, you need to think again about the origin and insertion. It depends, if the forelimb is movable and free. In this case, the function of this muscle is to bring the forelimb forward and extend, for example, the shoulder joint. While if the forelimb is fixed on the ground, in this case, contraction of this muscle will turn or move the head laterally. This is the case when one of the muscle is contracted while the other one on the other side is not. So that means if the right brachiocephalic muscle contracts, the forelimb is fixed on the ground, the head will move to the right side. The opposite is for the other muscle. But what if both brachiocephalic muscles are contracted at the same time, left and right? In this case, the function will be to move the head and neck down ventrally. This is the function of the brachiocephalic muscle. Another muscle we can see in this area here is the omotransversarius muscle. The omotransversarius muscle is this one here. Can you see that? It somehow moves under the brachiocephalic there, this direction. If you dissect this muscle, you will find it originating from the atlas, the first cervical vertebra, and the axis in small ruminants, and moves all the way backward and inserts to the acromion of the scapula. Let me show you the acromion. So let's put the scapula in place here like this. You will see that the omotransversarius muscle or omotransverse muscle inserts to the acromion. This is the acromion, which forms the distal end of the spine of the scapula. The insertion of the omotransversarius muscle. The next muscle I would like to talk about is this muscle here called the latissimus dorsi. The latissimus dorsi originates from the thoracolumbar fascia there, which the fascia itself originates from the spinous process of the thoracic and the lumbar vertebra. That's why we name it, and it's a very identified, fascia in this area. And that's why we name it thoracolumbar fascia. This is the origin of the latissimus dorsi. The latissimus dorsi is very, very flat muscle and very big, and that's why we can name it as the broad muscle of the trunk, or broad muscle of the thorax. Broad muscle of the thorax. The latissimus dorsi moves all the way to the medial side of the forelimb and inserts to the teres major tuberosity. Let's look at the humerus again. So this is the normal position. The right humerus in small ruminants looks like this somehow. Okay, and the latissimus dorsi moves all the way to the medial side, not lateral side, medial side, and inserts to the teres major tuberosity, this rough area here on the medial surface of the humerus. Teres major tuberosity. And later you will understand why we name it teres major tuberosity, because it's also the insertion of another muscle called the teres major muscle. Okay, this was the latissimus dorsi. The latissimus dorsi is innervated by a nerve which we can find on the medial side of this muscle. I will show you after we cut this muscle. So this is the latissimus dorsi. The nerve called the thoracodorsal nerve, which moves on the medial surface of the muscle next to another artery and vein. They have the same name, thoracodorsal nerve, vein and thoracodorsal artery. This was the latissimus dorsi. The function of the latissimus dorsi, think again about the origin and insertion. If the forelimb is free and not fixed on the ground, in this case, contraction of this muscle will move the forelimb backward. If the forelimb is fixed on the ground, in this case, the trunk will move cranially somehow and to the side. So the next step will be like removing the superficial muscles in this area here and talk about more deeper muscles. See you later.